Hi everybody, welcome to episode 16 of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Prednisone. However, in certain parts of the video, I will have to speak more broadly about corticosteroids in general. This is because a lot of corticosteroids actually share the same monograph, so a lot of information overlaps for each one of these medications. So corticosteroids are synthetic analogs of hormones which are secreted by the adrenal cortex. The glucocorticoid activity results in anti-inflammatory effects, and the mineralocorticoid properties have salt-retaining effects. Each corticosteroid has these properties in varying degrees. Now, in terms of how the medication is available, just talking about prednisone, it's available as a 1 milligram, a 5 milligram, as well as a 50 milligram tablet. The anti-inflammatory dose for prednisone is 5 milligrams. Now, corticosteroids can be used for many different reasons. I'll name some indications now. Just keep in mind that these aren't all specific to prednisone, and we're just talking about the class in general. They can be used for endocrine disorders, such as primary or secondary adrenocortical insufficiency. They can be used for rheumatic disorders or collagen diseases, for example, psoriatic or rheumatoid arthritis, dermatologic diseases, such as acute severe contact dermatitis, or widespread atopic dermatitis. They can be used for short-term administration in severe or incapacitating allergic conditions. An example here would be perennial allergic rhinitis or bronchial asthma. Corticosteroids can also be used in severe acute or chronic allergic and inflammatory processes involving the eye, such as allergic conjunctivitis. We see them used in respiratory diseases, such as moderate to severe croup, neoplastic diseases, such as leukemias or lymphomas in adults. They can be used to induce diuresis when people have severe edema. We also see them used as an adjunct therapy when people suffer from Crohn's or ulcerative colitis. They can help in the treatment of acute exacerbations of multiple sclerosis. And finally, they can be used in high doses along with other immunosuppressive therapy to prevent the rejection of an organ after organ transplant. Moving on now to contraindications, or reasons this medication cannot be used by an individual. There are two things I'd like to mention. The first is if somebody had a systemic fungus infection, they should not use a corticosteroid. And the second is that it's contraindicated to administer a vaccine that contains a live virus to an individual who is using a corticosteroid, such as prednisone. There are several warnings as well on the monograph. In this episode of Drug Talk, we're just going to discuss 3 of them. The first is that if somebody was using this medication and they were to stop the medication abruptly, they may experience withdrawal symptoms. The second is that corticosteroids, such as prednisone, have the ability to mask signs of a peptic ulcer. So it's possible that an individual using a corticosteroid could suffer a peptic ulcer or a hemorrhage but not experience significant pain. And lastly, corticosteroids have the ability to mask the signs of an infection. This is important because these medications may have a negative effect on your immune system. Now, moving on to precautions, the first thing I'll say is that because complications associated with treatment of corticosteroids is usually dependent on the dosing regimen, a risk-benefit analysis will be done by each clinician and decide whether or not daily or intermittent treatment is best for each individual. It's always a good idea to use the lowest possible dose, which gives control to the condition which is being treated. It's also important to note that corticosteroids have the ability to cause mood disturbances, such as hypomania, mania, depression, or psychosis. These effects seem to be dose-related and typically happen in the first couple weeks of therapy, but they can emerge later on in therapy as well. The use of systemic corticosteroids may also be associated with a loss of bone density or even osteoporosis. Luckily, this is reversible when the corticosteroid is discontinued. If somebody is using these medications chronically or long-term, their clinician may choose to prescribe them vitamin D and calcium as well, in an attempt to prevent this from occurring. Now, I can't give a specific recommended dose for prednisone because, as with all corticosteroids, dosing range is wide and depends on several factors such as the diagnosis, severity, prognosis, probable duration of disease, as well as patient response. As an example, I mentioned earlier in the video that the anti-inflammatory dose for prednisone is 5 milligrams. But as an example, for ulcerative colitis, you can see up to 40 or even 60 milligrams used. For prednisone, on the drug monograph, the maintenance dose is categorized as 5 to 15 milligrams. A moderate dose is described as 0.5 milligrams per kilogram of weight of the patient. A high dose of prednisone is categorized as 1 to 3 milligrams per kilogram, and they describe a massive dose as 15 to 30 milligrams per kilogram. Quick note, I didn't choose the word massive, it's really on the drug monograph. Now, when the medication has been administered over the course of weeks and the patient is looking to come off the medication, it should be tapered gradually to decrease the risk of any adrenal insufficiency. This is mainly because adrenal suppression can happen in even just 2 weeks of therapy. A number of different tapering schedules have been suggested, ranging from a decrease in dose from 2.5 to 5 milligrams every 3 days to 2 weeks. During the course of a taper, if there is a flare, the dose may have to be increased above where it was initially, and the taper may have to be more gradual or over a longer period of time. When treating acute conditions where prompt relief is imperative, higher doses of corticosteroids may be used, and they should be stopped as soon as possible. For chronic conditions, some clinicians prefer to use alternate day dosing. This is when an individual would take the dose every other day in the morning. Again, as I mentioned, there's a lot of different ways to dose these medications, and it really comes down to the clinical experience of the physician as well as the disease that's being treated. Now, if you are using a corticosteroid, there are some side effects that you may experience during your course of therapy. Occasionally, there can be ECG or echocardiogram changes due to a potassium deficiency. Syncope or fainting has occurred in individuals, and some people may experience a raise in blood pressure. Impaired wound healing may occur, as well as the development of thin, fragile skin. Some people may experience redness in the facial area, and it's also possible to experience hyperglycemia or a raise in blood sugar. Females may experience menstrual irregularities. In terms of fluid and electrolytes, there could be fluid retention as well as an increase in sodium. Nausea and vomiting have occurred, and interestingly, there could be anorexia or a decrease in appetite, which could lead to weight loss. And just the opposite of that, there could be an increase in appetite, which could lead to weight gain. That's all we're going to talk about today with corticosteroids, namely prednisone. As always, this channel is only to be used for information purposes. And if you have any questions about your personal care, direct them towards your personal healthcare provider. If you'd like to help the channel grow, you can like the videos, share the videos, or subscribe to the YouTube channel. All right, that's it for me. Take care.